folks, in the interest of time and respecting yours, we're going to go on ahead and begin. We do understand it is being recorded and into meetings laws that have been suspended, but we still want to try to comply with the recording of this meeting will be available publicly shortly after this meeting. So without further ado, we do have two items on the agenda today, as you know. We have a speaker from the New York City Department of Health and Mental Hygiene, Dr. Bedell. Welcome to the Borough Board. We will also do an update from our friends over at the Census Bureau, Jeff Baylor, who is no stranger to the Borough Board. We know that there are a lot of challenges underway within both departments, both agencies, both bureaus. And so we look forward to both of your presentations. So without further ado, we've got Dr. Bedell, Assistant Commissioner and Medical Director for the New York City Department of Health and Mental Hygiene. And Dr. Bedell will update our board on the agency's response to what else than the ongoing COVID-19 pandemic. Welcome, Dr. Bedell.
Okay, thank you very, very much. Just slight friendly amendment. Previously retired, but drafted back into service for this crisis. So actually I just retired a month ago, but that was a quick retirement because here we all are. So thank you for giving the agency and myself an opportunity to present, because one of the things that we're finding is there is a lot of information out in the world about COVID-19, probably exponentially more every day. And as there's more information, in a way, it becomes harder to navigate that information and to contextualize it. So I want to leave a lot of time for questions, because that's really the most important part. But I'll take a few moments just to set the foundation. So I'm going to talk a little bit about where we are, a couple of caveats about what we know and what we don't know, and then what the city is facing and the state and the country, to be honest. So everybody knows there is what is called in public health terms, widespread community transmission. That means like other coronaviruses that are so mild in comparison, like a cold, this is moving around so much that we can't really say, oh, you got it from this person or that person. It's too widespread. It's more the way a cold would go through a community, where you'd be at a gathering and somebody would say, oh man, I got a terrible cold last week and it really gave me a terrible headache. And somebody else would say, oh, I got that too and I got a terrible headache. And a third person would say it. And those are people who are probably all affected by the same virus. So this is also a quote unquote coronavirus, and it spreads in a similar way, which is respiratory droplets and contact. And I'm sure there's going to be some questions about that, but that's the important thing for people to know. And while we don't know every single wingle scientific thing about the virus, we absolutely know enough to break the chain of transmission. Those things we know, and those are the things that we're all doing, and that you know, we're going to have to get used to repeating over and over again, because if we don't do them well now, this will continue to percolate through the population. More people will get sick, some people will die, and if we are able to, you know, as an ICU doctor says, just follow the rules. If we're able to do that, then this will be more short-lived and won't go on for a whole heap of time. So most important thing, stay at home, like I see most of you are doing, because that looks like people's homes, not so much your offices. So that is great. That's because distance is the most important thing. The second most important thing is to wash your hands frequently. When in doubt, wash your hands, because like I said, it's a respiratory droplet and contact, because we come in contact with the results of the droplets. So as much as possible, isolating yourself, sadly, from people, 6 feet when you're in casual contact or more, face covering, that's just another way to separate yourself. And, you know, stay at home, stay at home, stay at home. That is the safest thing for New Yorkers to do. And the other thing that I would add is that it's really important for leaders, to help direct people to credible information, because there is a lot of incredible information out there. In fact, it's false information. And so we all have to do our best to get people hooked into key sources. Myself, I wake up in the morning and I go to the New York City Department of Health website. I go to the mayor's page for what the city is doing overall. I go to the CDC. I go to the state, and then I go to the CDC. And if I'm feeling very international, I go to the WHO. That's my starting point. Those are credible public health resources, so super important. So let's get down to the New York City and Queens level. We just updated the numbers on the City Department of Health website. They get updated every day. And you know, one of the most important things, which we're all affected by, is the deaths. So we are up to 9,101 confirmed deaths of people in New York who tested positive. There's about another 4,500 or so who we believe also died as a result of coronavirus. And in this last day, there's been 290 confirmed deaths. So on a normal day, New York City experiences about 150 deaths. So this is almost double that. So just to say that our healthcare systems, our hospitals, our nursing homes are still at this very critical level. In Queens, which has the highest number, not the highest rate, because it's not, it has to do with how much your overall population is, but in terms of number of deaths, the number of deaths so far is confirmed is about 2,600, and another 700 or so that we believe through these other methods are probably related to coronavirus. So Queens is definitely, you know, suffering as we all are. This data is on the website. I go to certain places over and over again and just kind of keep updating myself because those are the things I'm interested in. There's lots of other places that people can go and just kind of check in because this gets updated all the time. So I want to say just before there are questions and discussion that there's really, there's three ways that I'd like to present the information. One is what is known in the public health world. And I know it also, and so I can say it with great confidence to you. Then there are things that are known out there, but I don't happen to know them. So I'm going to take them down, and one of my colleagues is on the call here also. And I think we've done a pretty great job of coming back, and we will get back in touch with the Borough President's office if there's something that I cannot answer, you know, because I don't happen to know the answer to that. And then the third thing is that there are things that nobody knows. You know, I'll need to say that also. That's a great question, and nobody really knows the answer to that. And that, of course, is very uncomfortable for people because we like to know what's going on, and particularly during a health crisis, we like to know what's going on. So the things that public health knows, and I know, I hope that's most of your questions. Then there might be some things that I know somebody knows, I don't happen to know them. And then there are things we don't know. And again, it's important for leaders to help people with the anxiety and the distress that is caused by everything that's going on, but particularly about things that we don't know all of the answers for. But I want to emphasize that we absolutely know enough about this virus and the way it's transmitted to break the chain of transmission. And several countries have done that now. So that knowledge is out there, and that's what we have to focus on. So that's all introductory comments. Happy to field questions or comments.
Thank you, Dr. Bedell. I see that we've been joined by Councilmember, I think that's Councilmember Robert Holden, even though under the alias Brian Holden. Welcome, Councilman. Don't see any other.
Thank you.
Joined us.
There we go.
I'd like to turn the floor over to the council members first. Are there any questions that you have? Councilmember Kozlowitz, Councilmember Richards, Councilmember Holden.
Just three quick points. Is DOH working? And I know that this is more state related. I wanted to hear a little bit more about your coordination with nursing homes. Mm-hmm. I also wanted to hear, I know the mayor had made an announcement about working with clinics. And I have not heard much more than that announcement. Specifically, we have centers like the Adabo Health Center, and I know I've given that to the administration at least 2 or 3 times now. And then I wanted to see if DOH would eventually release those deaths by zip code. So I know that the data has started to get more transparent, but if more of a breakdown of where are we seeing the deaths at. And then the last question was just on the testing sites at Queens Hospital, has that started up as of yet for seniors specifically? So we've been working collectively in Southeast Queens to make sure more testing was happening. The mayor did announce that testing would be expanded. Believe Queens Hospital would be the location, at least for now here. Wanted to just hear how's that going and what are we doing to promote that? So those, sorry, I had a lot of questions, Sharon, but those are just 4 things. So the nursing homes, which I know are state, but the clinic, breakdown by zip code on the deaths, and then the testing site at Queens Hospital.
Great. Okay, so I will take those in the order. So as you know, and probably most of the people assembled here know, but the public doesn't know, there are different things that the city is responsible for versus the state. And the state regulates the actual delivery of medical care. And the state, for example, is in charge of licensing. My medical license is through New York State. The city has nothing to do with my medical license, and the license to operate medical facilities is conferred by the state. So there is a difference in responsibility. Nursing homes, being a medical facility, are regulated by the state. That being said, the city has always, the health department has always seen the people who are in nursing homes as part of the population of New York City, and has tried, and I think been successful, of course, to varying degrees at different times, in working together with the state in terms of preserving the safety of both the residents of nursing homes, the people who are in nursing homes, and also importantly, the people who work in the nursing homes, who are often, usually, typically New York City residents as well. So we are, we are meeting and working with the state constantly. That's sort of just a general rule. And I'll just say I was very involved in the response to Superstorm Sandy, and then that was another place because there's a lot of nursing homes in the Rockaways, and I was deployed to the Rockaways, and we really had to work quite in concert with the state in order to, again, to preserve the safety of both the residents of nursing homes and the staff of nursing homes. So the kinds of things that we are working on is if nursing home patients need a higher level of care, what's the best way to route those people? That's really a concern that the state and the city share. Then there is the reporting of the level of care needed and the reporting of deaths, and those things we are doing, again, in concert with the state. The city has put out guidances for healthcare workers. Any facility can take those guidances as they wish. The state is in the position to mandate different things. So I think we're doing a fairly good job of working together with the nursing home population and the staff. And of course, the more that the governor and the mayor can work hand in hand, the less confusing it is for people, for their families, and for the staff. So that's the nursing home part of it. I hope I answered your concern there. Next was, I wrote these things down. Oh yeah, so the clinic. So part of the response to the disparity that we see in different neighborhoods are being hit at different rates, different levels with COVID-19 for a host of reasons. And one of the responses of the mayor is to enlist community clinics, both federally qualified healthcare centers and other local clinics, because those are often trusted voices in the community. And you mentioned the Adobo if I'm getting the name correctly. I remember them from the Rockaways. That's a very robust clinic center there, and it has, you know, it has a lot of services there. So the idea is going to be to work with the clinicians there who are trusted, credible messengers to continue to get the public health messages out. And that work just began last week. So a lot of it is the planning, and it will result at a minimum in a communications effort that's going to be targeted in different neighborhoods differently, and uses the voices not of, you know, the distant wherever, City Hall or wherever, but the more local voices. So that's coming up. Next is data by zip code. There is data by zip code, so that you have to
I'm
go
saying on the deaths. I don't remember seeing that.
on the deaths. Hold on.
It's on the website.
All the list of everything. You're right, and we have cases by zip code, but not deaths by zip code. So let me. I'm not sure. That's one.
Just want to put that on your mind. I just want that. I know it's not there.
Yeah. Okay. So I got it. I mean, you know that it's going to correlate, because wherever there's a high rate of positives, there's likely to be higher than average deaths. But you're right, that is not on my list of, you know, the 20 different sources of data that are all on the website. Okay.
I watch it religiously.
Very good. And then testing. So it is still true, you know, now many weeks into this pandemic, that there is not enough testing materials to test widely. That is a national problem, which New York State has struggled with from day -1, because whatever day we all think of as day 1, the health department really was tracking this weeks prior, and there was pressure around testing for weeks. So New York State's not going to be able to solve that problem, and New York City's not going to be able to solve that without there being a national approach to this. The priority for testing is still in the people who are extremely ill, who are hospitalized generally, and who the decision about where to put them or whether a ventilator is appropriate there, the test is really going to help you make a critical clinical decision. And that's where the testing is. We are not yet up to the place where we can do widespread testing. And while I've got people's attention about testing, I want to, because this is going to be one of the things I think we're going to struggle with. There are going to, right now, there's just one kind of test. I'm sick, I have symptoms. There is a test. This is the nasal pharyngeal swab. It's a very uncomfortable test. If you've had a child who's ever had to have it, they're wiggling and squiggling because it doesn't feel good. But it's very important to get the swab up in there to find pieces of the virus itself. That test tests whether you are currently have the infection. Once you finish with that infection, that test should become negative, right? So that's the test that we have now. Are you infected now? The second test, which is coming up, but it is not available yet, will test our immune response, which is more long-lasting, to the virus. And that is, people either call it an antibody test, or it's also called serology. And that is a blood test. And in that test, you find out whether you ever had the infection. So if I got sick, the test to see if I'm infected, we do that test, then I get better. That test becomes negative if we repeat it. But then we do the serology, or the antibody test, and that test becomes positive because it shows that I developed an immune response. That test is coming. And once we have that, we're going to be able to learn a lot about how far and wide this infection has gone in our city and our state. So that's kind of a stay tuned for this, because that's going to be helpful to understand how much of the population has already seen this virus. Because the second time it comes around, if it does come around again, it won't be novel, it won't be new. Some of us will have already seen it. And it's important for us in public health to know, was it 5% of the people who had it or 25% or whatever? We don't know yet. So right now, one test just tests for infection, but coming soon to a testing site near you is this other test, which will show that you had it once. So that being said, there's still not enough tests, and tests are being prioritized for people who are very sick. And the other group is first responders, healthcare workers, police, firemen, et cetera. And we're still in that formation until we get more of the materials for testing. Last week, there was, I mean, I think we're through it for now, but it's very fragile. There were not enough swabs. Well, you can't do the test that's a swab if you don't have the actual swabs. But the state and the city have done a pretty good job of evening out the supply of all these materials, but it's a tenuous hold on supply for testing. That's a very long answer. Did I get to your issues about testing?
Yeah, yes, you did. So Queens Hospital has started.
They have started, I believe, I'm almost certain, I'm 99% sure that testing is for healthcare workers. Because they're a high priority.
Okay.
Dr. Bedell, questions from the chat room. One actually is a good segue from the testing that you talked about. Could you tell us where are the city-run testing centers in our borough? And then followed by, I think we have questions from, and that's a question that's shared by Chair Agliaro of Board 11. And then we also have questions from Chair English of Board 3, followed by Chair Bratton of Board 10. Yeah,
okay. So the testing sites are going to be and are being set up at H+H facilities. And again, they're not really, I know the mayor has mentioned them, but they're not really for widespread testing yet because there isn't enough testing material. So I can get a list. I don't have the Queen's list in my head. Most of my work has been in the Bronx, so sorry about that, apologetically to all you fabulous Queens people. So I know a little bit more about the details. So I'm just gonna, I will get back to you about the exact list and we'll send it to the Borough President's office and then you guys can disperse it if that's okay. But the same information about the testing sites applies. It is being prioritized to people who are sick, and there's a clinical decision, and to first responders and healthcare workers, because we have to know if they're infected in order to say whether it's a good idea for them to be working, obviously not if they do have the infection. So I'll get back to you with the list, right? That it sounds like somebody wants a list of where the sites are. I don't have
both the sites that are active as well as those that are in the works and their location.
Oh yeah, and the other thing to say about testing, right, is that that some of the testing will be done by New York State, and that's a different system. And so the city health department, I mean, we will know about that as it develops, but we're not going to be running those testing sites. So we are going to have this kind of interesting dual testing system set up. Those are really, all of this is being set up in preparation for the time when we have more testing material that will enable us to do widespread testing. Right now, if you have very mild symptoms and you call your primary care doc, they have been and are and should be saying, stay at home, I'll help you get through your symptoms, but no, do not go to an emergency room or a clinic to try to get a test, because we can't use a test on somebody who's not, ready for a hospital admission. So until there's an ability to test widely, most of this discussion about testing sites, is for the future, to be honest.
We understand. Thank you, Dr. Bedell. And yes, the question is for the testing centers that are city run. We have a question from Chair English of Board 3.
Yeah, hi, how are you? My area is East Elmhurst, Jackson Heights, and North Corona, and we're close to Elmhurst Hospital, and a lot of people feel very uncomfortable going to Elmhurst Hospital in regards to testing. So we really need another testing site in our area. And another thing that's very confusing to people that aren't well, they may have slight symptoms now, but it may go 360 degrees where they're not well. They're staying at home, and these people are staying at home and they're passing away. So this is what really concerns. I don't know if the message is there. At what point do you send yourself to the hospital? You go to the hospital because a lot of people are passing away at home.
Right, right. That's an excellent question. And thank you for reminding me to say that H+H has set up a fairly robust system of clinicians who are available by telephone and are very, very knowledgeable about the clinical progression, which is somewhat predictable now that we've had more experience, the clinical progression of COVID-19 infection. So I personally know of several people in the Bronx who have used the 311. You call 311, you say that you have symptoms, and they put you into this bank of clinical staff. It's doctors, nurse practitioners, et cetera. And they, and if you need a Spanish-speaking physician, there are Spanish speakers there, et cetera, et cetera. If they need to get somebody to do interpretation, they will do it. There are times in the day when there's more of a wait for that 311 to a clinician. They are working on that. So I'm not going to say it's working like 100% perfectly, but it is fairly robust now. So anyone who is at home and has any question at all, because no one should be dying of COVID-19 at home when they could have been, saved by an intervention at a hospital. And I agree that people may have gotten this message, everyone's
Very
trying to do
mixed
the right
message.
thing. Yeah, and people are trying to do the right thing, right? They're trying, okay, I'm gonna stay home. I mean, I have people who I'm following because they have something else not related to COVID who they would normally go to a doctor, but they're like, I don't wanna go because I don't wanna clog up the space there, which is great. And we also want to make sure that people get the care that they need. So people who have a primary care doc, most of the clinics are ramping up to be able to do telemedicine and video conferencing and that kind of medicine. But 311 will get people in to see, to hear, I guess we have to say, to be on the phone with a doctor who can take them through. And you can call back as many times as you need to. I was feeling this way this morning, but now it's midnight and I'm feeling worse. What should I do? You wake up in the middle of the night and you feel like, oh my God, am I short of breath or I'm just nervous? I don't know. So you can get through to a doctor at 311. It's kind of amazing how quickly the city's been able to ramp that up. So it's always better to go first to your own doctor if people have one, but a lot of people don't. And so 311 is there for them. And the person has to say that they think they have COVID-19. And anyone who has any of these sort of typical cold symptoms or anything, we are currently assuming all of those people have COVID-19, and we're treating with that in mind, obviously, because that would be the most serious thing to overlook. So does that clarify what options people have?
That clarifies options, but I think that message should be put out so folks in the public can have that understanding. And again, I say Elmhurst Hospital should not be the only option in regards to testing for my area.
Right. I got it.
Yeah, please. Yes, thank you.
Thank you, Chair English. Dr. Bedell, we probably should have prefaced this. You may or may not know, but obviously by volume of deaths, it's rare for anyone to not have been touched or impacted by COVID-19. A number of us have not only lost beloved family members or community members, but also members of our community boards. So it's still very raw, but we understand. We thank you for your candor in all the information.
Yeah.
No,
there is probably not a person in New York who has not been infected in some way. And, that reminds me to say also that another thing that's important for all of us to do is to normalize the incredible depth of reactions and grieving and changes that all of us are going to go through. I mean, that is unprecedented. It personally, it reminds me, although not quite as extensively, but in the beginning of the HIV epidemic, nobody knew what HIV was. We didn't even know it was a virus when I started in medical school. And then we came to know so much about it. And in a much longer period of time, pretty much every person in New York City was affected and knew someone who was either suffering with HIV, AIDS, or had died. And this is, of course, it's different. Every virus is different. But in such a short time, it's completely had an impact, probably touched every single New Yorker. So that's something we have to help people, you know, live with and grieve and or turn off to, you know, just the whole range of emotions. There's a whole set of mental health resources also on the Department of Health website, phone numbers, again, that people can call so that they can talk to somebody in real time. People are isolated. It's exactly what you don't want to do when somebody's going through a terrible emotional thing. So there are people there. Again, there are times in the day when there are a lot of callers. And so we've had some peak times and there's been a longer than we wanted wait time. Those are being ironed out. So that's another place where people can get help, not of the immediate medical kind, but of the emotional support kind. So we urge people to use those resources, both the 311 for medical, but 311 will also hook people into the counseling services. So that's super important.
Thank you, Dr. Bedell. And on a quick note, reminder to the Borough Board, we will be hosting an interfaith vigil, a virtual one, tomorrow at 5, I think it's 5 p.m. On our website, hosted by many of actually all the council members here as well. We have a question from Chair Bratton of Board 10. Back to testing.
Thank you, Borough President. Dr. Bedell, thank you for the information that you're providing. Many of the calls that we're getting regard testing. Am I clear that what you said was that there is no antibody testing going on right now? And does that apply to the entire state or, you know, just to the city? And secondly, as we ramp up both in the state and the city, can we get some kind of a clear fact sheet in regard to testing and what the procedures will be for getting tests?
Yeah. Absolutely. Okay, so there is no antibody testing approved and in use for what's called point of care testing, which is what we would want, your regular average person. That does not exist anywhere in this country. So it's not a city or a state or a regional thing. That is a every person thing. It exists in other countries. I'm not going to lie to you. Other countries have developed an antibody test, but ours has not been developed and approved for use in the United States yet. But everyone who is working on this is fairly certain that that is going to come soon, within days to a short amount of weeks, because there are a couple of things that are, beneficial is not the right word, but there are certain elements of the virus itself, and also we've learned so much about antibody testing and how to develop antibody testing that that's going to happen relatively soon. But right now it's not available anywhere. And in fact, the health department sent out a letter to physicians because we're quite worried that some companies are trying to market things that aren't approved yet. And, you know, that will give people—
That's part of the problem. The message is getting to people
Exactly.
that there is antibody testing.
Mm-hmm.
Yeah, so that's a problem. You know, so what we've done is send out what we call a Dear Colleague letter. It goes to physicians, to laboratory directors, to people in the clinical field, basically saying, do not purchase anything that is being marketed to you as an antibody test because they're not developed yet. And we will let you know, of course, when there is one, and provide guidance both for the clinicians who need to be mindful of what a positive result means and doesn't mean, and what a negative means and doesn't mean. And as soon as there is a test, there will be guidance for clinicians and also you know, that's definitely going to happen. But I'm also making a note, and for sure I'm going to take all of these and elevate them. But you're saying a testing
People
sort
have
of
a lot of
sheet
questions.
for the general public.
Yeah,
Yeah.
yeah, some type of a fact sheet that
Yep.
explains in layman's language to people who are concerned and fearful, and who, because there are testing sites that they are expecting, they can just go get a test.
Right. Right. Yes.
Some
Yes.
clear guidance so that people know what to expect.
Yeah. Yeah, and what the test means and what it doesn't mean, so that
That
people
would be
don't
very helpful as
put the
well.
wrong. Exactly. Yes, and I'll just echo something that Dr. Birx, you know, if we're watching the Tony Fauci, Deborah Birx, you know, nightly show, she said something that I think was very applicable to New York City and New York State. The people who really are going to understand the difference between this first test that we're doing now, that tests whether you're infected, that's what's called a PCR test, and the second one that's being developed, the antibody or serology, the people who really know that, who are in your community, are people who have been affected by HIV and AIDS, because the exact same methods are used for the PCR testing, which is the viral load testing for HIV, and the antibody testing, which is what we commonly call the HIV test. So there are people who are, she was very, I thought quite wonderful in honoring how much knowledge people in the community have who have been active in the HIV AIDS world now for decades. They understand these tests. And so she urged them, honestly, I forget, sometime last week, I was like, wow, I've never seen a federal level official do this, but she urged them to reach out to elected officials, to local leaders, and help us all understand these two kinds of tests, again, what they are and what they are not. So you probably have experts in your community districts. Those are about the tests themselves. They just have to kind of convert that knowledge to this virus, which is pretty easy to do. So I just offer that because she had put that out. And there's going to be, you know, we all became public health epidemiologists. Now we're all becoming virologists, and then we're going to become testing experts. And that's what we're going to have to do because that's the way that we're going to together surmount this. So, you know, seek out the expertise that's in your community district as well. And, you know, that's a note to the health department as well, because we've long been working in the world of HIV, of course.
Dr. Bedell, we have a comment or a question from Councilmember Holden.
Thank you, Borough President, and thanks, Dr. Bedell. A couple of just points and a few questions. One, we got a complaint early on in the pandemic that the Department of Health had cut their hours. We got the complaint from funeral directors that they cut their hours to register people who have passed. And it was like, it went from 24 hours a day to 9 to 3:30 for a while. Now, I think you have now fixed that kind of, you have online registration for death certificates. Is that true?
Yeah, so yes, I can find out about online registration, which is the way it's been done before. And yes, the systems for handling deaths and the systems of this system that goes from a hospital or a nursing home or a person's home, to the funeral home got backlogged for many days. I mean, we had a day sometime last week. I'm looking for my little data here. Hang on. We had a single day last week where we had 800 deaths. So that's a lot. That is more probably than this whole system has seen ever. So things did get backlogged. My understanding is that things are more under control now, and that the usual systems are back in order. There may be a little bit of a delay, but it's not like it was, that was either a week or two, I guess it was 2 weeks ago, where we had that big bump, and that created a huge backlog. There were a lot of sort of incredible, untrue stories, but the truth is that we've been able to work through the backlog, and now there will be some delays, but we're not getting the same reports of that we got previously. And for family members who are concerned, they should utilize the exact same systems that they always have, which is to arrange with the funeral home the disposition of the body, and then the funeral home arranges with the hospital.
Well, the funeral homes are, I'm sorry, but the funeral homes are still telling us that there's a delay, especially at the cemeteries. I have a lot of cemeteries in my district, and they have no masks. That we had to get masks for the staff of the cemeteries. They're afraid to get too close to the family members. And what we're seeing also from the cemeteries, they're saying they don't have enough staff. They have shifts now, but they cut it. So we have more deaths, less burials in the cemeteries in my district, at least. And it's causing still a backlog. Right now, family members are waiting 2 weeks to bury, or maybe more, 3 weeks. And so we're getting complaints from the family members, the morticians, and obviously the cemeteries. Now, I've written to the governor and to the mayor several times about trying to employ out of work construction workers who know how to use the heavy equipment and can help the cemeteries with the staffing. I haven't gotten an answer yet. I know that they're bringing in out of state morticians to license them, but that's not enough at this point. It's the problem that I'm hearing from the funeral homes. It's not on their end. It's on the back end mostly. And that's why we have some nursing homes that are piling up the dead, and it's really terrible. And even the morticians are telling me to get into some of the temporary areas where they're keeping the bodies. They have to climb over bodies. There's no lights in those tents or trailers. And it's an unsanitary situation that they're dealing with. So there still needs some work here. And I hate to bring this up, but that this is a fact that we're dealing with, at least in my office. So anything you can do on your end to get to the governor or the mayor, I'd appreciate.
Okay, yeah, no, I hear that. And I think, that this is sort of, you're at the final end of the pipeline there in the cemetery situation, right? So things are getting a little bit, what we hear is a little bit eased up on the hospital funeral director side, but now there's a pile up at the end of the supply chain, if you will. So yes, I will take that concern. And from a health point of view, we don't see anything that's alarming. This is not like Ebola was a virus where the handling of the body had to be done meticulously. This virus is not transmitted that way. So people are right to be concerned about social distancing from the family members who are still alive, because that's the way you could get it. And all of the regular precautions apply. 6 feet of distance. Everybody should have face coverings. That's the law of the land right now. And when in doubt, wash your hands or use a hand sanitizer. So all of those things, I'm going to take those concerns, because particularly for workers who are outside, that may not be so easy to do some of those things. So if there are ways that we can think about how to help protect them, I will elevate that as well. Thanks for that concern.
Thank you, Doctor.
Any other questions from the board? Dr. Bedell, thank you so much. I understand that we'll be anticipating 2 follow-ups. One, the death counts by zip code, and if that could be broken down in both confirmed deaths as well as the probable, right. As well as number 2, a list of the New York City run testing sites in Queens, both A, active and online, and B, that are anticipated.
Right. And then the other thing that I have, a third thing, is just to clarify these issues around the burial and the pipeline part. So I got 3 things.
Thank you very much. Look forward to your follow-up, and thank you for returning and for your service, Dr. Bedell.
Yeah, no problem at all.
All right, stay safe. And you're welcome to stay for the continuation of the Borough Board.
So are you going to talk about census stuff now?
We are moving on to
Super important.
no strings to the board. You are certainly welcome to stay, Dr. Bedell, but
Okay, I'll probably turn my video off, but I want to hear because the census is so important and we're so worried at the health department that we're going to have even more of an inaccurate count than we sometimes do have. So everything that everybody can do to improve the count of the census, I'm happily cede the rest of the time to the census discussion because that's so important, and appreciate all the good questions, everybody. Thank you.
thank you, Dr. Bedell. And with that, it's a perfect segue into our next speaker, Jeff Baylor, Director of the New York Regional Office for the United States Census Bureau. And without further ado, please, Mr. Baylor, thank you for your patience. We're glad you're here.
No, I enjoyed the conversation. Thank you, Dr. Bedell, for your questions. You are a trusted voice on everything, including the census, so we appreciate your comments. Borough President Lee, thank you for your leadership. It's been a pleasure working with you and your team. Susie and Tim are amazing. They've done just a wonderful job in supporting of the census. And I want to thank the Complete Count Committee members and all the leaders throughout Queens that are supporting census activities. Kind of briefly, three things I do want to talk about where we're at right now as far as self-response rates. I want to talk about some of the changes that we've introduced based upon a proposed operational schedule change. And then third, things we can do right now. So first off, where are we at? Nationally, today's numbers that came out, we're at 50.7% national self-response rate. So these are the percentage of households that have either gone online, called it in over the phone, or filled it out on paper. So nationally, 50.7. In the state of New York, we're at 44.8% self-response rate. We're closing that gap from the state to the national level, which is good news. New York City just hit 40%. Again, that continues to grow. And Queens is, as of today, is at 38.8%. So again, Queens is closing the gap between New York City and Queens. We know we have some areas that we want to focus on. And I've been working with Susie and Joe Salvo and others throughout Queens, trusted voices, to really understand, put together a strategy, a plan that we can do. But we know we need to improve in North Corona and East Elmhurst and Richmond Hill, South Jamaica and South Ozone Park. But we've also had some success stories as far as some very high rates in the Bay Terrace, Clearview, Fort Taunton area, in Oakland Gardens, and some other areas. So we have improvements to make, but I really believe, being in the heart of COVID-19 and all the challenges that have taken place, and removing probably one of the strongest the things that we have in Queens, the face-to-face interaction when it comes to issues that, like the census, because it's so important to bring people together, to educate them, to put them in a place they feel trusted, to motivate them to respond. So I think we're off to a great start. We do have some work left to do, and we look forward to working with you and doing that. So let me talk a little bit about the schedule change. So first off, we are in the middle of our mail out, or our mailing number 4. In mailing number 4, we mail a paper questionnaire to every household that has yet to respond. That mailing started April 8th. It was scheduled to be done by April 16th, but due to COVID-19 and the facility in which we do our national mail out from, it was shut down numerous times. We, of course, have staffing issues with COVID-19. So that time period will be extended to April 30th. So by April 30th, every household in Queens will receive a paper questionnaire if they haven't responded yet. So typically during a census, you see little peaks of self-response. Census Day was a nice peak of self-response. This mail out is also a peak of self-response, because it will be the first time many households in Queens will have a paper questionnaire that they can fill out and mail it back in. Last Monday, a week ago today, a new schedule was proposed. So our director, Dr. Stephen Dillingham, and the Commerce Secretary, Wilbur Ross, submitted released a joint press release asking for statutory relief from the one date in a census that's under law. And that date that's currently under law is that we have to provide the apportionment counts to the President of the United States by December 31st of 2020. We are seeking statutory relief of 120 days basically pushing that date out to April 30th. What that does, it gives us ample time and opportunity to really adjust our operational schedule. And there's two key dates in that proposed schedule that I want to mention. First off, self-response. So the time period that people have to go online, to call it in over the phone, to fill it out on paper and return it, has under this proposed schedule will be extended to October 31st. Okay, it's currently mid-August, but under this plan, we would extend self-response to October 31st. Now, we certainly don't want the message to be, hey, everyone, you have until October 31st to fill it out. We need people to fill it out sooner rather than later, because regardless of when you fill it out, we're asking you about who lived at that address as of April 1st, 2020. Okay. In addition, the other date that's key to note is the date we'll start knocking on doors. So the largest operation we conduct, non-response follow-up, knocking on the doors of every address in which we haven't received a census response. Under this proposed schedule, that will begin August 11th. Okay, so that's a date. If you need a date to use out there to motivate your communities, that would be a good date to use, August 11th, because starting on August 11th, we're going to be knocking on doors of every household that has yet to respond. Now, a couple of things about that August 11th date. We're still recruiting. So people can still apply for jobs online. There's nothing they would need to do in person. They go to 2020census.gov, click on the jobs link, and they can apply. We don't, while we've reached our goals in Queens, I think we're at 112% of our recruiting goal. Given COVID-19, we don't know how many of those recruits, how many of those people who've applied are seriously consider working for the census, knowing that they're going to have to work in communities. So that's why we don't want to stop recruiting. So if you are aware of anyone who may be interested, again, this is a great gig job. People can work their own schedule, second or third job. They can give us 10 hours a week. They may speak the language that we need. They may understand the culture that of that particular neighborhood. So we want to continue to allow people to apply. We're changing the way we're training people. In the past, we bring people together in a classroom for a day, send them home for a week to do some online work, and then bring them back for a day. Now, the only thing we're doing, we're bringing people together in very small groups of 2 to 3. We swear them in as a federal employee, give them their handheld device, and we send them home. All the rest of the training is done virtually. And then they can begin their assignment after that. All right, so again, that we're looking to start hiring again, start making those calls as early as mid-May. Part of that, if once someone accepts the job, they have to get fingerprinted. We will not fingerprint anyone earlier than June 1st. And we're going to be following the local guidelines. And if the guidelines tell us we cannot be out there doing this at that time, we'll push those dates farther into the calendar year. Okay. Lastly, I just wanted to finish up with kind of what we can do now. And I've been working with Susie and others, as I mentioned earlier, Joe Salvo, to take a look at those areas in which we're not doing as well as the others. What are some things we can do as far as advertisement goes? We may be getting some additional funding that we want to use for New York City, but we want to put it in the right areas. And when we do that, we want to make sure we have the local faces and the local voices of those areas, whether it's on posters that we put in bodegas and drugstores and restaurants and grocery stores, whether it's a radio advertisement, whether it's a TV interview, whether it's a print ad. We need your help in understanding who are the trusted voices and what are the best vehicles for getting that message to the community. In addition, we need to know from you, what is that best message? So we need the messaging, the vehicle of getting it there, and then we need the face and the voice. And we hope we can count on you for your help in getting that information so that if we are going to spend funds, it makes sense. It makes sense for your communities. The other thing that we're asking people to do is please, as everyone is a trusted voice to someone else, just sharing the information, sending a text, giving a call to someone, and then asking them if they haven't filled out their census, if they would take the opportunity to send a text to everyone in their phone book or give a call to their family members and ask them, have they completed the census? And if not, tell them how safe it is, talk about how important it is for the next 10 years, and talk about how easy it is by filling it out or on the phone online or on paper. No communications are ever too small, especially in a time right now with social distancing. In addition, other things we can do that we've been doing, we're looking with restaurants who with takeout, giving them little half pagers of census information to remind people to go out and fill out their census if they haven't. We're in the process of sending 3,000 tote bags to organizations in Queens that they can use at their food pantries. So when they're handing out food, it's going to be in a 2020 census bag with a little flyer talking about how important the census is, include phone numbers or the website to go to. So we have the ability to directly send these materials to anyone, any address you give us. So this is another opportunity for you that we look for your input. Anything you can do, we will support Queens in any and all ways that we possibly can. But we need your help in doing that. We need to understand what's effective for your communities. And we look forward to gathering that information over the next few weeks. Thank you for the time, Borough President Lee, and I'll turn it back to you for any questions.
Thank you, Mr. Baylor. You mentioned that the Bureau is still recruiting for your jobs. I'd like to officially invite the Bureau to be part of our jobs recruitment fair that we're having this Wednesday. I don't know if people saw. I can show you real quick. So we'd love for you to be a part of this, and we can talk to you more about that offline.
Absolutely.
Also, let's see. I wanted to thank you for the Bureau's working with us. I understand that you sent out thousands of those tote bags. We made sure that those are going to CBOs that were distributing meals and grocery boxes to seniors and families that are homebound. So thank you very much for that. We know that Queens took a big chunk of New York City's share, so thank you. And then also wanted to remind the Borough Board, there is a Text Out the Count campaign, I understand, this Thursday. We are being encouraged by New York City Census to participate in a day-long citywide Text Out the Count campaign. So that might be part of the uptick that Mr. Baylor, you talked about, similarly to the April 1 and things like that. So I wanted to put those dates on the board's radar. Are there any questions from the board right now?
This is Dolores. I have a question. How are you handling resident locations such as nursing homes, group homes? In Rockaway, we have St. John's Home for Boys. How are you contacting them by mail? Are you going to be going out? Do you have that list that you're going to actively take care of those locations?
Yeah, thank you for the question. So part of our group quarters operation, we actually began in February. And what we did is we called every group quarters across the nation. And we introduced ourselves and we asked them how they wanted their facility to be enumerated. It could be, we'll give you a web link and a special password, and you go online and you enter the information yourself. You can give us a paper listing of everyone who lives at your facility, and we'll take that information and key it ourselves. We can drop off materials, questionnaires that you can hand out, and we'll come back and pick them up. Those are just 3 of the options. So every group quarter had the ability to choose that option back in February. For every group quarter that chose an option like drop off pickup or in person, we were calling them, we sent a letter, and now we're starting the phase of calling them, asking them if they would like to change that enumeration method to make it easier for them. Whether that's simply FedExing us a listing of all the people in their facility as of April 1st, or if they choose to go online, or they can even email us via a secure server, that paper listing or that electronic listing. So we want to make it as easy as possible. We will continue to allow group quarters such as nursing homes to change the way they chose to be enumerated to try to make it as easy as possible. That's currently scheduled to go through September 3rd under the proposed schedule.
So just to follow up on that, is there any way that you could provide to the Borough President a list of all groups that have responded or not responded, so that maybe we could be a little proactive locally in reaching out to them because we know many of the operators? And also, do you have a current list by zip code of how many households have responded or not responded?
Okay, so the first question regarding the list of group homes and contacts, let me check into that. I have to make sure nothing, we still have to follow the law, Title 13, and I want to make sure that's not considered Title 13 data. So let me get back to you on that one. Assuming that we can share it, absolutely, especially those that have yet to respond or we've been unable to reach. The second thing regarding responses by zip code, we don't have responses by zip code. That's not and this is census speak. Zip codes aren't really a geography we use. We use it to get a piece of mail to a household, but we actually use GPS coordinates. So you can see data at a neighborhood level, which is what Joe Salvo and the New York City Census are putting together. But we also have it at a census tract level. And we have staff, but we'd love to do a demo, a one-on-one, if you'd like, showing you how to use the tool that we have available if you're interested in seeing that very low level of detail to see what percentage of households have responded.
Yes, and so how would we reach out? Who would we reach out to for that?
You can just reach out to me and I'll put you in touch with your local partnership specialist.
Wonderful, thank you.
Thank you.
Mr. Baylor, you mentioned that Queens, our response rate as of now is 38%. How does that fare to this time 10 years ago? Are we on par? Are we slower, ahead from this time 10 years ago?
Yeah, it's hard to compare, Borough President, only because 10 years ago, all we had was paper. This time around, we had more. So I can tell you at the beginning, we got out much quicker nationally in 2020 than what we did in 2010. And that makes sense because people could respond online and it was immediately captured and we showed it as being completed rather than having to be mailed back and go through the mail stream. We don't have projections at the city level or at the borough level. We don't even have projections that we shared publicly. All I can tell you is conversations with management staff at our headquarters. We have, and shocking to me, we have been at or slightly above the projection on a day-by-day basis. Given COVID-19 and everything that it's done, it's taken away, the partnership program and doing things in person, our ability to bring devices to people, to let them, fill it out online at a place they feel comfortable with with the device that's provided to them with internet service. So it's a testament to the work that all of you, that the CCC members, that Susie and Tim and all their hard work over the past year and a half and kind of creating that foundation of education, that foundation of trust. But unfortunately, we just don't have the daily rates to compare to 2010.
Got it. Any other comments or questions from the board?
Yes, I have a question, Borough President Betty.
Yes, please.
It's going to sound ghoulish, and I do not intend it to sound ghoulish, but we have thousands of people in this city and in this borough who were alive on April 1st. We have thousands of families who the last thing on their mind would have been filling out the census. Between now and the deadline, can we figure out some type of graceful way to reach out to those families to get the census forms reflecting the lives, if for no other reason? It's a way to memorialize that they lived.
Yeah, I think that's a great question and a great point. And I agree, we have to be extremely careful in how we do that. So we will look to help from our partners who are probably, to many people, the federal government is not a trusted voice. We're not the right ones that
True, but, within the structures of the city and the state, we know who the people are at some level of government.
Yep.
And how do we reach out in a tactful way?
Yeah, I think that's definitely a conversation we need to have, how we can do that. And again, operationally, we need to count everyone who is living on April 1st at that particular address. So operationally, it can be done. It's how we tactfully do that, as you mentioned.
Thank you.
Any other comments or questions? I mean, to that note, Chair Bratton, it's anybody who was living as of April 1, if they were born April 1 or March 31st, they would also be counted, right?
Right.
Okay. All right. Any other comments? Mr. Baylor, thank you very much again for coming back to the Borough Board, and thank you for all that you do.
And thank you. Have a good night.
All right. And with that, that concludes our meeting. Thank you, everyone, for your patience with our technical hiccups at the beginning. But
It was fine.
it was fine. And again, it's very good to see everyone's faces and hear your voices. Again, wanted to remind you, we have a interfaith vigil happening tomorrow. We urge you to come. We also have the recruitment fair, the jobs recruitment fair that we discussed. That will be Wednesday. Also, to put on your radar, we have a parent advisory board meeting next Thursday, April 30th. That will also be virtual and online. And with that, the next meeting of the Borough Board will be Monday, May 18th at 5:30, to be determined whether it will be virtual or in person. But regardless, we will put your safety first. And thank you, everyone, and have a wonderful day.